Describe the advantages and disadvantages of hormonal contraceptive methods. What specific patient populations might benefit from these methods and what contraindications should be considered? Answer. Hormonal contraceptive methods include pills, patches, and rings, which primarily work by suppressing ovulation and thickening cervical mucus. Advantages. Effectiveness. Hormonal methods are highly effective in preventing pregnancy up to 99% with perfect use. Regulation of menstrual cycles. They can help regulate menstrual cycles and reduce menstrual cramps. Reduction of acne. Some hormonal contraceptives can improve acne. Disadvantages. Side effects. Potential side effects include weight gain, mood changes, and increased risk of thromboembolic events, particularly in smokers over 35. Daily compliance. Pills require daily adherence, which may be challenging for some patients. Contraindications. Absolute contraindications include a history of thromboembolic disorders, certain cancers, e.g., estrogen sensitive, and uncontrolled hypertension. Patient populations. Young women with irregular menstrual cycles may benefit from hormonal methods, while women with specific health concerns may require alternatives. Relevant guidelines. According to the CDC's United States Medical Eligibility Criteria for Contraceptive Use as MEC, clinicians should assess patient medical histories before prescribing hormonal methods to minimize health risks. What are the primary causes of hypoactive sexual desire disorder (HED) and what treatment approaches should be considered? Answer. Hypoactive sexual desire disorder (HED) is characterized by a lack of sexual desire that causes distress. Causes. Psychological factors. Stress, anxiety, depression, and relationship issues can significantly impact sexual desire. Medical conditions. Chronic illnesses, hormonal imbalances, e.g., low testosterone in men or estrogen in women, and medications, e.g., SRS can contribute to HSDD. Treatment approaches. Therapy. Cognitive behavioral therapy (CBT) can help address psychological issues. Medications. Flibanserin and bremelanotide are FDA approved for the treatment of HSDD in premenopausal women. Lifestyle modifications. Encouraging exercise, healthy diet, and stress management techniques can improve overall well-being and sexual desire. Explain the principles of informed consent in obstetrics and gynecology. How should practitioners ensure effective documentation and patient education? Answer. Informed consent is a fundamental principle in obstetrics and gynecology that ensures patients are fully informed about their treatment options and associated risks. Principles. Voluntariness. Patients must give consent freely without coercion. Comprehension. Information should be presented in a way that the patient can understand, considering their educational background and health literacy. Disclosure. Practitioners must provide all relevant information about the procedure, including risks, benefits, and alternatives. Effective documentation. Detailed records. Document the consent discussion, including the information provided and the patient's questions and understanding. Patient signature. Obtain a signed consent form, ideally during a follow-up appointment, to reinforce understanding. Patient education. Use teach-back methods to confirm understanding and encourage patients to ask questions. Utilize brochures, videos, and other resources to aid comprehension. Mrs. Thompson, a 32-year-old woman with a history of migraines with aura, is considering contraceptive options. What should you advise her regarding hormonal contraceptives and what alternative methods could be appropriate? Answer. Given Mrs. Thompson's history of migraines with aura, she is at an increased risk for stroke when using estrogen-containing hormonal contraceptives. Advice. Avoid hormonal methods. It is advisable to avoid combined hormonal contraceptives, pills, patches, and rings due to the elevated stroke risk associated with estrogen in women with migraines with aura. Alternative options. Progestin-only pills, POPs. These may be considered since they do not contain estrogen. Long-acting reversible contraceptives, LARCs. Options like IEDs, e.g., minor, scalar, or implants, e.g., Nexplanon, are highly effective and do not involve estrogen. Relevant guidelines. The CDC's USME-C recommends that women with migraines with aura should not use estrogen-containing contraceptives. A thorough assessment of her overall health and individual needs should guide the final contraceptive choice. Discuss the mechanisms of action, indications, and potential side effects of intrauterine devices (IDs). How should providers counsel patients regarding these factors? Answer. Intrauterine devices (IDs) are a form of long-acting reversible contraception (LARC) that provide effective pregnancy prevention. Mechanism of action. Copper IUDs, e.g., Paragard, release copper ions that are toxic to sperm, preventing fertilization. Hormonal IUDs, G. Minor, chylina, release levonorgestrel, thickening cervical mucus, inhibiting sperm movement, and thinning the endometrial lining to prevent implantation. Indications: women seeking long-term contraception, those who prefer a non-daily contraceptive option, patients who cannot use hormonal contraception due to contraindications. Potential side effects: copper ions may cause heavier menstrual bleeding and cramping, especially in the first few months. Hormonal ions. Side effects may include hormonal symptoms such as breast tenderness, mood changes, and irregular bleeding patterns, which typically improve over time. Counseling points: providers should inform patients about the mechanism of action, efficacy rates over 99%, and potential side effects. Discuss the return to fertility after removal, emphasizing that fertility typically resumes immediately. Relevant guidelines: the American College of Obstetricians and Gynecologists (ACOG) recommends LARCs as first-line contraceptive options for most women due to their high efficacy and low maintenance. In what ways can healthcare providers facilitate open communication about sexual health issues with their patients? Discuss the importance of sensitivity and inclusivity in these conversations. Answer: facilitating open communication about sexual health is vital for effective patient care. Strategies for providers: creating a safe environment. Providers should ensure privacy and create a non-judgmental atmosphere that encourages patients to express concerns freely, using open-ended questions. Asking open-ended questions, e.g., "How can I help you with your sexual health concerns?" allows patients to share their thoughts and feelings without feeling constrained. Active listening. Demonstrating empathy and understanding through active listening can help build trust and rapport. Sensitivity and inclusivity. Cultural competence. Providers should be aware of diverse cultural beliefs and practices regarding sexuality and be respectful of different perspectives. Gender identity considerations. Use inclusive language when discussing sexual health to accommodate patients of all gender identities and sexual orientations. Importance: open communication can lead to improved patient satisfaction, better adherence to treatment plans, and ultimately better health outcomes. Relevant guidelines. The National Institutes of Health (NIH) emphasizes the necessity for healthcare providers to engage in culturally competent and sensitive care to address sexual health issues effectively. What are the legal considerations regarding confidentiality when treating minor patients in obstetrics and gynecology? How should providers navigate ethical dilemmas in these situations? And so, confidentiality is a crucial aspect of patient care, especially for minors seeking obstetric and gynecologic services. Legal considerations. Informed consent. In many jurisdictions, minors may consent to certain medical treatments, e.g., contraception, STI testing, without parental notification, particularly when it pertains to reproductive health. State laws. The laws governing minors' rights to confidentiality vary by state. Providers must be aware of local regulations to ensure compliance. Ethical dilemmas. Providers may face situations where a minor's request for confidentiality conflicts with the need to inform parents, especially in cases of serious health issues or abuse. Balancing autonomy and safety. While respecting a minor's autonomy is important, providers must also consider their duty to protect minors from harm, which may necessitate parental involvement in certain cases. Navigating ethical issues. Engage in discussions with the minor about the importance of involving parents while respecting their wishes. Document discussions and decisions made regarding confidentiality and parental involvement to ensure clarity and protection for both the provider and the patient. Relevant guidelines. The American Academy of Pediatrics provides guidance on the rights of minors to confidentiality in health care and the circumstances under which parental involvement is necessary. What are common side effects associated with contraceptive methods, and how should providers counsel patients on managing these effects effectively? Answer: contraceptive methods can lead to various side effects that may affect patient compliance and overall satisfaction. Common side effects: hormonal contraceptives. Nausea, headaches, mood changes, weight gain, and breakthrough bleeding are common side effects of hormonal contraceptives. IDS users may experience cramping, spotting, or heavier menstrual bleeding, especially in the initial months. Counseling strategies: educate patients. Providers should inform patients about potential side effects during the consent process to set realistic expectations. Management techniques: offer strategies to manage side effects, such as, for nausea, taking pills at bedtime or with food. For mood changes, regular follow-ups to assess mood and consider alternative methods if necessary. A 24-year-old woman named Sarah comes to your clinic seeking information about her options for an unplanned pregnancy. She expresses confusion about the laws surrounding abortion in her state. How should you provide information about her options, and what ethical considerations should guide your counseling? Answer: when counseling Sarah regarding her options for an unplanned pregnancy, it's essential to provide clear, factual, and supportive information while considering the ethical implications involved. Information provision. State laws. Begin by informing Sarah about the specific abortion laws in her state, including waiting periods, mandatory counseling, and parental consent requirements for minors if applicable. Options available. Discuss the full range of options, including continuing the pregnancy and parenting, adoption, providing information on resources for both open and closed adoptions, abortion, both medical and surgical options. Ethical considerations. Non-judgmental support. It's critical to create a non-judgmental environment where Sarah feels safe discussing her feelings and options. Informed decision-making. Encourage her to reflect on her values and circumstances to make an informed choice. Provide resources for further support, such as counseling services. Respect for autonomy. Respect her autonomy by supporting her decision, whatever it may be, while ensuring she has access to all necessary information and resources. Relevant guidelines. The American College of Obstetricians and Gynecologists, ACOG, provides guidelines on the ethical responsibilities of physicians in counseling patients on abortion, emphasizing informed consent and respect for patient autonomy. Discuss the importance of incorporating gender identity and sexual orientation considerations in gynecological care. How can providers ensure inclusivity in their practice? Answer: incorporating gender identity and sexual orientation considerations in gynecological care is essential for providing comprehensive, respectful, and effective health services. Importance: health disparities. Individuals from marginalized gender and sexual identity groups may face significant health disparities due to stigma and discrimination in healthcare settings. Tailored care. Understanding a patient's gender identity and sexual orientation allows providers to offer tailored, culturally competent care that addresses specific health risks and needs. Ensuring inclusivity. Training and education. Providers should participate in training programs focused on ETQ health issues, enhancing understanding and reducing biases. Inclusive language. Use gender-neutral language and ask patients their preferred pronouns. Ensure that medical records reflect this information. Patient-centered communication. Foster an environment where patients feel comfortable disclosing their identities and concerns without fear of judgment. What are the key components of an effective risk management strategy in obstetrics and gynecology, and how can these components be integrated into daily practice? Answer: an effective risk management strategy in obstetrics and gynecology includes several key components. Risk identification. Regularly assess potential risks associated with clinical practices such as surgical procedures, medication administration, and patient follow-ups. Incident reporting and analysis. Implement a system for reporting adverse events and near misses. Utilize root cause analysis (OCA) to identify underlying issues that contribute to risks. Quality assurance. Establish protocols for routine audits and evaluations of clinical outcomes to ensure compliance with established guidelines. Education and training. Provide ongoing education to staff on risk management policies, emphasizing the importance of adherence to protocols. Patient involvement. Engage patients in their care by providing clear information about procedures and potential risks, thus promoting shared decision-making. Monitoring outcomes. Track and analyze patient outcomes and satisfaction metrics to identify areas for improvement. By integrating these components, practitioners can create a culture of safety, reduce incidents, and enhance patient care quality. Describe how cultural competency impacts patient care in obstetrics and gynecology. What strategies can be employed to ensure culturally sensitive care? Answer: cultural competence is crucial in obstetrics and gynecology as it influences patient-provider interactions, compliance with treatment, and overall health outcomes. Understanding cultural influences on health beliefs and practices allows providers to offer personalized care. Strategies for culturally sensitive care include cultural assessment. Conduct assessments to identify patients' cultural backgrounds, beliefs, and preferences regarding health and wellness. Education and training. Offer training for healthcare providers on cultural awareness and sensitivity, helping them understand diverse health practices. Language services. Provide translation services for patients who speak languages other than English to ensure clear communication. Patient engagement. Involve patients in discussions about their care plans and respect their cultural preferences regarding treatment options. Community outreach. Collaborate with community organizations to enhance understanding of health disparities and promote culturally relevant health education. Mrs. Thompson is a 28-year-old patient who recently immigrated from a country with significantly different healthcare practices. She expresses concerns about the safety of certain medications and prefers herbal remedies. As her healthcare provider, what steps should you take to address her concerns and ensure effective communication? Answer: in managing Mrs. Thompson's care, the following steps should be taken. Cultural inquiry. Start by asking open-ended questions to better understand her beliefs regarding medications and herbal remedies. This will help to build rapport and trust. Education on medications. Provide clear, understandable information about the medications prescribed, including their benefits, potential side effects, and how they compare to herbal remedies. Explore herbal remedies. Discuss any herbal remedies she is considering or currently using, ensuring that you evaluate their safety and interactions with prescribed medications. Involve family members. If appropriate, involve family members in discussions to ensure that they are informed and can support her in her healthcare decisions. Follow-up. Schedule regular follow-ups to reassess her understanding and acceptance of the treatment plan, making adjustments as necessary based on her feedback. This approach emphasizes respect for her cultural beliefs while ensuring she receives safe and effective care. What role does effective communication play in improving patient safety and quality in obstetrics and gynecology? Provide examples of communication strategies that can enhance patient-provider interactions. Answer: effective communication is essential for improving patient safety and quality in obstetrics and gynecology, as it helps prevent misunderstandings, ensures informed consent, and fosters patient trust. Key communication strategies include active listening. Practitioners should listen carefully to patient concerns and questions, validating their feelings and ensuring they feel heard. Clear and concise information. Use layman's terms when explaining medical conditions, procedures, and risks to avoid confusion. Teach back method. After providing information, ask patients to repeat back what they understood. This confirms their understanding and allows for clarification. Patient education materials. Provide brochures and resources that patients can take home to reinforce discussions and facilitate further understanding. Shared decision-making. Involve patients in their care decisions, ensuring they understand their options and implications, which can lead to better adherence to treatment plans. By implementing these strategies, healthcare providers can improve patient satisfaction, reduce errors, and enhance overall care quality. Explain the significance of quality improvement initiatives in obstetrics and gynecology. What steps should healthcare providers take to implement such initiatives effectively? Answer: quality improvement (QI) initiatives are vital in obstetrics and gynecology, as they aim to enhance patient outcomes, minimize errors, and improve overall care delivery. The significance of QI initiatives includes enhance patient outcomes. By systematically addressing areas of concern, QI initiatives lead to better health outcomes for patients. Increased efficiency. Streamlining processes reduces waste and ensures that resources are used effectively, improving care delivery. Stakeholder engagement. Involving staff in QI processes fosters a culture of accountability and continuous improvement. Steps to implement QI initiatives effectively. Identify areas for improvement. Use data analysis to pinpoint specific problems within care delivery, such as high rates of cesarean deliveries or complications. Set clear goals. Establish measurable goals for improvement, such as reducing infection rates or enhancing patient satisfaction scores. Develop and test interventions. Implement changes on a small scale, monitor their effects, and adjust as necessary based on feedback and outcomes. Discuss the importance of interprofessional collaboration in the context of obstetrics and gynecology. What strategies can be employed to enhance teamwork among healthcare professionals? Answer: interprofessional collaboration is critical in obstetrics and gynecology, as it ensures comprehensive care for patients and leverages the expertise of diverse healthcare professionals. The importance of collaboration includes holistic patient care. Teams can address multiple aspects of a patient's health, leading to more coordinated and effective treatment plans. Improved outcomes. Collaborative care has been shown to improve patient satisfaction and reduce complications. Shared knowledge. Team members can share insights and knowledge, enhancing the overall skill set available to patients. Strategies to enhance teamwork. Regular team meetings facilitate open discussions about patient care, allowing team members to share insights and strategies. Clear roles and responsibilities. Define each team member's role in patient care to avoid confusion and ensure accountability. Collaborative care plans. Develop care plans that incorporate input from all team members, ensuring that diverse perspectives are considered. Continuing education. Provide opportunities for interdisciplinary training, allowing team members to learn about each other's roles and expertise. Conflict resolution mechanisms. Establish protocols for resolving conflicts within the team, promoting a collaborative environment. By fostering interprofessional collaboration, healthcare providers can improve the quality of care in obstetrics and gynecology. How do healthcare disparities impact reproductive health care, and what measures can practitioners take to address these disparities? Answer. Healthcare disparities can significantly impact reproductive health care by limiting access to services and contributing to poorer health outcomes among marginalized populations. The impact includes limited access to care. Socioeconomic factors can restrict access to essential services such as prenatal care, contraception, and family planning. Poor health outcomes. Disparities often result in higher rates of maternal morbidity and mortality, particularly in minority populations. Cultural barriers. Misunderstandings about cultural practices and beliefs can hinder effective communication and care delivery. Measures to address disparities. Community outreach. Engage with communities to identify barriers to care and provide education about available reproductive health services. Culturally competent care. Train healthcare providers to recognize and respect cultural differences in health beliefs and practices. Policy advocacy. Advocate for policies that promote health equity, such as expanded access to insurance and funding for community health programs. What strategies can be employed to ensure continuity of care for patients transitioning between different levels of care in obstetrics and gynecology? Answer. Ensuring continuity of care during transitions is essential for optimizing patient outcomes in obstetrics and gynecology. Key strategies include care coordination. Assign a care coordinator to manage patient transitions, ensuring clear communication between different healthcare providers and settings. Comprehensive discharge planning. Develop discharge plans that include follow-up appointments, medication reconciliation, and patient education on post-discharge care. Patient engagement. Involve patients in their transition planning, educating them about their conditions and the importance of follow-up care. Communication protocols. Establish standardized communication methods, e.g., electronic health records, to share patient information promptly and accurately among providers. Follow-up reminders. Implement reminder systems to ensure patients attend follow-up appointments and adhere to care plans. By employing these strategies, healthcare providers can improve the transition process and enhance the quality of care for patients. What are the implications of patient safety incidents in obstetrics and gynecology, and how can healthcare organizations learn from these incidents to prevent future occurrences? Answer. Patient safety incidents in obstetrics and gynecology can have severe implications, including adverse patient outcomes, increased liability, and loss of patient trust. The implications include increased morbidity and mortality. Incidents can lead to serious health complications or death, particularly in high-risk populations. Legal and financial repercussions. Organizations may face lawsuits and financial penalties, which can impact their operations and reputation. Loss of trust. Patients may lose confidence in the healthcare system, leading to reduced utilization of services. To learn from safety incidents and prevent future occurrences, healthcare organizations can conduct thorough investigations, use root cause analysis (RCA) to understand the contributing factors of incidents and develop targeted interventions. Implement safety culture training. Promote a culture of safety by educating staff about the importance of reporting incidents and near misses without fear of retribution. Regular audits and assessments. Conduct audits of clinical practices to identify areas of risk and implement evidence-based interventions. Feedback mechanisms. Establish systems for staff and patient feedback on safety issues, ensuring continuous improvement. Collaborative learning. Share lessons learned from incidents with other healthcare organizations to enhance collective knowledge and prevent similar occurrences. By focusing on learning from incidents, healthcare organizations can improve patient safety and enhance the quality of care in obstetrics and gynecology. Discuss the importance of monitoring patient satisfaction in obstetrics and gynecology. How can healthcare providers effectively measure and respond to patient feedback? Answer. Monitoring patient satisfaction is critical in obstetrics and gynecology as it provides insights into the quality of care provided and areas for improvement. The importance of patient satisfaction monitoring includes quality improvement. Patient feedback helps identify strengths and weaknesses in care delivery, informing quality improvement initiatives. Patient retention. Satisfied patients are more likely to return for future care and recommend services to others. Compliance with standards. Regulatory bodies often require patient satisfaction data as part of accreditation processes, linking it to overall quality metrics. Effective measures for monitoring and responding to patient feedback include surveys and questionnaires. Utilize standardized patient satisfaction surveys, e.g., COPS, to collect quantitative and qualitative feedback on various aspects of care. Focus groups. Conduct focus groups with patients to gather in-depth feedback on their experiences and suggestions for improvement. Real-time feedback. Implement systems that allow patients to provide feedback immediately after their visit, enabling timely responses. Action plans. Develop action plans based on survey results outlining specific improvements to be made in response to patient feedback. Transparency. Share results with staff and patients, demonstrating a commitment to addressing concerns and improving care. By effectively measuring and responding to patient feedback, healthcare providers can enhance patient satisfaction and overall care quality in obstetrics and gynecology. Describe the role of luteinizing hormone LH and follicle-stimulating hormone FH in the menstrual cycle. How do these hormones interact to regulate ovulation? Answer. Luteinizing hormone LH and follicle-stimulating hormone FSH are crucial for regulating the menstrual cycle through their roles in follicular development and ovulation. FSH, produced by the anterior pituitary gland, stimulates the growth and maturation of ovarian follicles. As follicles mature, they secrete estrogen, which provides negative feedback to the pituitary to inhibit FSH release. This ensures that typically only one follicle reaches maturity during each cycle. As estrogen levels rise, they eventually reach a threshold that triggers a positive feedback mechanism, leading to a surge in LH production. This LH surge is critical for ovulation, causing the mature follicle to rupture and release an egg. The subsequent rise in LH also stimulates the transformation of the ruptured follicle into the corpus luteum, which secretes progesterone. Progesterone prepares the endometrium for potential implantation. If fertilization does not occur, the corpus luteum degenerates, leading to decreased levels of estrogen and progesterone, ultimately triggering menstruation. Understanding these hormonal interactions is vital for evaluating menstrual disorders and infertility issues. Discuss the risks and benefits of hormone replacement therapy (HRT) in menopausal women. What factors should be considered when recommending HRT? Answer. Hormone replacement therapy (HRT) offers several benefits for menopausal women, including relief from vasomotor symptoms, hot flashes, night sweats, prevention of osteoporosis, and improvement in mood and quality of life. However, HRT also carries risks, including an increased likelihood of breast cancer, cardiovascular events, and thromboembolic disorders. When recommending HRT, clinicians should consider individual risk factors such as age, personal and family medical history, e.g., breast cancer, thromboembolic disease, the severity of symptoms, and the patient's preferences. The choice between estrogen-only and combined estrogen-progestin therapy is also critical, particularly for women with in uterus, as estrogen-only therapy increases the risk of endometrial hyperplasia and cancer. Guidelines from the North American Menopause Society suggest that HRT be used at the lowest effective dose for the shortest duration necessary to manage symptoms, emphasizing the importance of a shared decision-making process between the clinician and patient. Mr. and Mrs. Thompson have been trying to conceive for over a year without success. They are both 32 years old and have no known medical conditions. What initial workup would you recommend for their infertility evaluation, and why? Answer. For Mr. and Mrs. Thompson, an initial infertility evaluation should include a thorough history and physical examination for both partners, followed by specific testing to identify potential causes of infertility. Female partner evaluation, hormonal testing, serum levels of FSH, LH, estradiol, progesterone, and thyroid hormones to assess ovarian reserve and function. Transvaginal ultrasound to evaluate for structural abnormalities such as polycystic ovarian syndrome, PCOS, or uterine fibroids. Hysterosalpingography (HCG) to assess the patency of the fallopian tubes and the shape of the uterine cavity. Male partner evaluation. Semen analysis to assess sperm count, motility morphology, and overall seminal fluid characteristics. What are the indications for performing a hysterectomy in women? Discuss both absolute and relative indications. Answer. Hysterectomy is a surgical procedure that involves the removal of the uterus, and it may be indicated for various reasons. Absolute indications: malignancy, endometrial, cervical, or ovarian cancer requiring removal of the uterus, severe dysplasia, high-grade cervical intraepithelial neoplasia, (CIN) that does not respond to other treatments, uncontrollable uterine bleeding in cases where other medical management fails and the patient experiences debilitating symptoms. Relative indications: uterine fibroids when they cause significant pain, bleeding, or pressure symptoms and other treatment options are not suitable. Endometriosis, in severe cases where conservative treatments have not alleviated symptoms. Chronic pelvic pain, unexplained pain that has not responded to other therapies. Explain the advantages of laparoscopic surgery over traditional open surgery in gynecology. How do these advantages impact patient outcomes? Answer: laparoscopic surgery offers several advantages compared to traditional open surgery, including reduced recovery time. Patients typically experience shorter hospital stays and faster recovery, allowing for a quicker return to normal activities. Less postoperative pain. Smaller incisions lead to less trauma to the abdominal wall, resulting in low pain levels and reduced need for analgesics. Minimized scarring. The small incisions used in laparoscopic procedures result in less noticeable scarring compared to open surgery. These benefits contribute to improved patient satisfaction and decreased complication rates such as infections and hernias associated with larger incisions. Additionally, the minimally invasive nature of laparoscopic techniques can lead to enhanced visualization of pelvic organs, allowing for more precise surgical interventions. What is the recommended surgical management for endometriosis? Discuss the considerations for excising endometrial tissue. Answer: surgical management of endometriosis aims to excise or ablate endometrial tissue while preserving ovarian function and fertility when possible. The main techniques include laparoscopy. This is the preferred approach due to its minimally invasive nature. Surgeons can visualize the pelvis and excise endometriotic lesions using instruments introduced through small abdominal incisions. Cystectomy. If endometriosis involves the ovaries, excising endometriomas may be necessary to improve fertility and reduce pain. Considerations: surgical excision versus ablation. Excision, removal of endometrial lesions, is often favored over ablation. Destruction, since excision may provide more significant symptom relief and decrease recurrence rates. Postoperative care. Monitoring for complications, managing postoperative pain, and discussing potential hormone therapy to suppress residual disease are critical in the postoperative phase. During a laparoscopic myomectomy, what are the key factors that should be assessed preoperatively to ensure patient safety and optimal surgical outcomes? Answer: preoperative assessment for laparoscopic myomectomy should include imaging studies, ultrasound or MRI to determine the number, size, and location of fibroids, helping to plan the surgical approach. Patient's medical history, assessment for comorbidities such as obesity, diabetes, or cardiovascular disease, which may increase surgical risks. Anesthesia evaluation, ensuring that the patient is an appropriate candidate for general anesthesia and assessing any history of adverse reactions. Fertility considerations, discussing the impact of myomectomy on future fertility and any need for assisted reproductive technologies post-surgery. These assessments are crucial for minimizing complications and optimizing surgical outcomes. A 28-year-old woman presents with primary infertility after 1 year of trying to conceive. She has regular menstrual cycles and no significant medical history. What factors would you consider in her evaluation, and what initial tests would you recommend? Answer: in evaluating a 28-year-old woman with primary infertility, several factors must be considered. Ovulatory function. Despite regular cycles, ovulatory disorders can still occur. Blood tests measuring progesterone levels during the luteal phase can confirm ovulation. Anatomical evaluation. Pelvic ultrasound can assess for structural abnormalities like polycystic ovaries or uterine anomalies. Tubal patency. A hysterosalpingography (HRG) should be conducted to evaluate whether the fallopian tubes are open, which is crucial for natural conception. Initial tests should focus on ruling out ovulatory dysfunction, structural abnormalities, and tubal factors, as these are common contributors to infertility. Explain the process of informed consent in gynecologic surgery. What specific information should be included in the consent discussion? Answer: informed consent in gynecologic surgery is a legal and ethical requirement ensuring that patients are fully aware of the procedure and its implications. The process involves explanation of the procedure, detailed description of the surgery, including its purpose, techniques used, and expected outcomes, risks and benefits. Clear communication of potential complications, such as bleeding, infection, or anesthesia risks, as well as the benefits of the surgery. Alternative options. Discussion of alternative treatments or procedures available, including their risks and benefits. Voluntary participation, assurance that the patient understands they can withdraw consent at any time before the procedure. Documentation of the discussion and the patient's understanding is essential for legal protection and to uphold patient autonomy. Mrs. Sanchez is a 50-year-old woman experiencing severe menopausal symptoms. What factors should be considered when discussing the initiation of hormone replacement therapy HRT with her, and what guidelines should inform your decision? Answer: when discussing HRT initiation with Mrs. Sanchez, several factors should be considered. Severity of symptoms, the impact of menopausal symptoms on her quality of life and daily functioning, medical history, review of personal and family medical history, especially regarding breast cancer, cardiovascular disease, or thromboembolic disorders, age and time since menopause. Younger women or those recently menopausal may benefit more from HRT regarding bone health and symptom relief. Guidelines from the North American Menopause Society recommend HRT for symptomatic women at the lowest effective dose for the shortest duration necessary. A thorough discussion regarding the benefits versus risks, tailored to her personal situation, is essential for informed decision making.